Hey there, if you're watching this, chances are you're dealing with some pretty serious pain, or maybe you just got a diagnosis for something called a perianal abscess. I know it can be a really stressful and, honestly, uncomfortable situation, but you're in the right place. We're going to walk through exactly what's going on, step by step, to make sense of it all. Okay, so here's our game plan. First, we're going to break down what a perianal abscess actually is. Then, we'll get into the surprisingly simple reason they happen. After that, we'll cover how doctors figure it out, talk about the main treatment that brings relief, and then cover the easy steps for taking care of yourself afterward. And finally, we'll look down the road at what you can expect as you heal. Let's get into it. All right, let's start with the big question. What is this? That intense, throbbing pain and swelling you're feeling? Well, that's coming from an infection. The medical name for it is a perianal abscess. And the most important thing to know right off the bat is that this is incredibly common, and even better, it's very treatable.
To put it simply, a perianal abscess is just a pocket of pus that's built up in the tissue right around the anus. You can think of it like a boil or any other abscess you might get on your skin. Your body is basically walled off an infection. The key takeaway is it's a localized problem that we know how to fix.
Now, this is actually pretty interesting. These abscesses can pop up in a few different spots, but as you can see, the perianal type, the one that's right under the skin, is the most common one by a long shot. We're talking almost 43% of all cases. And you know what? That's good news, because it means it's the easiest kind for doctors to get to and treat.
So why does this even happen? I know a common worry is that it might be about hygiene, but let me be super clear about this. For the vast majority of people, that has absolutely nothing to do with it. This is usually just a simple and kind of unlucky biological thing that happens. Let me show you what I mean.
Okay, so inside the anal canal, we all have these tiny little glands. They're just a normal part of our anatomy, and 99% of the time, they just do their thing without causing any trouble at all.
But every once in a while, a little piece of debris can get stuck in the opening of one of these glands, basically clogging it up. You can think of it just like a tiny pipe getting blocked. And when that happens,
well, this is exactly what happens next. As soon as that gland is blocked, bacteria that are normally there get trapped inside. They have nowhere to go, so they start to multiply. Your body's immune system rushes in to fight them, and that whole battle creates the infection and that painful pocket of pus we call an abscess.
And get this simple blocked gland situation is the reason behind a whopping 90% of all these abscesses. So for most people, this isn't a sign of some bigger health issue. It's just a really common and very well understood plumbing problem, so to speak.
Okay, so we know what it is and why it happens. Now, how does a doctor actually diagnose it? Well, the good news is that this is usually a super quick and easy process. You're not typically in for a long series of complicated tests.
For the vast majority of these, all the doctor needs to do is take a look and gently feel the area. The classic signs, a painful, swollen red bump right near the anus, are usually a dead giveaway. They can often make a confident diagnosis right there in the office. And this is really reassuring for a lot of people. Unlike so many other medical issues, you probably won't need to go for any expensive or time-consuming scans like a CT or an MRI. For a classic, straightforward abscess, a simple physical exam is all it takes.
And now for the most important part of all of this. How do we fix it and make the pain stop? The answer is a simple, effective procedure that gives you relief almost immediately.
The top experts in this field are crystal clear about this. The right way to treat an abscess isn't with pills. The only way to truly cure it is to drain the infection out. That is the single most important step on the road to getting better.
So what does this drainage procedure actually look like? It's really straightforward. First, the doctor numbs the skin over the abscess so you won't feel any sharp pain. Then they make a tiny little cut to let the pus out. Let me tell you, that release of pressure usually feels like instant relief. Finally, and this might sound a little strange, they leave that little opening open. This is really important because it allows the wound to heal from the inside out and prevents the infection from just getting trapped in there all over again.
So, once that abscess is drained, the worst is officially behind you. Your main job is just to help your body heal, and the steps for doing that are really simple. It's all about comfort and keeping the area clean.
The main things you'll do are called sitz baths, which is really just a fancy term for soaking in a shallow tub of warm water a few times a day. It feels great and it helps keep everything clean. You'll also use a little bit of gauze on the outside just to catch any leftover drainage. And one really important thing to know, the old method of packing gauze inside the wound is generally not done anymore, because we now know it can be pretty painful and doesn't actually help it heal any faster.
Okay, this is a question we get all the time. If this is a bacterial infection, why aren't we just throwing antibiotics at it? It's a great question, and the answer is usually no, but with a couple of important exceptions.
Here's the key thing to understand. For a healthy person with a simple abscess, the drainage is the cure. You've literally removed the source of the infection. Antibiotics are really only needed in specific situations. Like, for instance, if the infection has started to spread into the skin around it, or if a patient has a weakened immune system and their body just needs a little extra help to fight it off.
All right, we've covered the what, the why, and the how. For this last part, let's look down the road a little bit. Let's talk about what happens after you've healed up from the abscess itself. It's good to know what you might expect in the future.
For about 2/3 of people, draining the abscess is the end of the story. It heals up and they never have a problem again. But it's important to know that for about 1/3 of people, a related issue can show up later on, called a fistula. Now, this is not a complication or a sign that the treatment failed. It's just a known possible outcome from the original infection.
So what on earth is a fistula? Well, you can think of it as a tiny tunnel that forms under the skin. It basically creates a permanent connection between that little gland that got blocked in the first place and the spot on your skin where the abscess was drained. If you get one, you might notice a little bit of persistent drainage, even weeks after you thought you were all healed up.
And if you do end up being in that 1/3 of people who develops a fistula, please do not panic. This is a very common issue, and there are well-established, effective treatments to fix it for good. It's absolutely something your doctor can manage.
So what does your path to getting fully better look like? Well, this whole explainer was meant to give you the building blocks, the knowledge to really understand what's happening to your body. Your most important next step is to take this information, feel more confident, and have a good conversation with your own doctor. Use what you've learned to ask great questions and be a partner in your own recovery. Thanks so much for taking the time to learn with us.